The main goal of preventing mother-to-child transmission is to prevent transmission of HIV from positive mothers to their babies. This form of transmission has continued to be the major source of HIV infection among children under the age of 15. This can occur during pregnancy, labor, delivery, and while breastfeeding. At the Maraba Medical Center, a center with the task of preventing mother-to-child transmission of HIV, we caught up with Ellen Pan, a positive mother who has successfully had 4 negative children through the PMTC program. She shares her story.
This routine tests pregnant women go through. I went through the routine test, and one of the tests that was compulsory that the pregnant woman should do is the HIV test. So with all pressure, I brought my thumb up and it was pricked, and lo and behold, I just saw some kind of result, and I was asking, what is this? Because my mindset then was HIV is gotten through sexual intercourse, and I know that I don't have 2 men in my life, it's just my husband. So I left that hospital. I started going to a faith home, and the faith home didn't help matter. By and large, I delivered the child and I lost the child. So on my next antenatal, I actually spoke to the nurse that this was my last resort. So I was placed on drugs, and I had my child, and my children are HIV negative.
Helen Pan, who is now a mentor mother, having successfully gone through PMTC, wants women of reproductive age and expecting mothers to check their HIV status and, when positive, to use the PMTC center to avoid transmission of the virus. She also wants the Nigerian government to improve quality of the PMTC services and strengthen mother-to-mother group, as this will go a long way to eliminating new infections among children.
Pregnant and HIV positive, you wouldn't need to pay for some services, but now with the user fees, you pay. These are issues now that affect intake for antenatal, and when the antenatal clinic is avoided, because it's the first step in achieving PMTCT, when the women don't come for antenatal, those services are not actually got.
In Nigeria, 267,000 children are infected with HIV, with only 54,000 children less than 14 years on antiretroviral drugs. The clinical officer at Maraba Medical Center says to ensure that the statistic doesn't increase, expecting mothers must take advantage of the antenatal care and adhere strictly to the PMTC instructions.
In a situation that she's not adhering very well to the drug because she didn't want to disclose her status to her husband, and thereby increasing the virus in her system, automatically the child will get the virus. But in a situation that she adheres very well to her drug, for sure the virus will reduce in the system, and thereby preventing the child from getting the HIV virus.
We let them know the reason why it is very important for them to continue the antenatal and deliver in the hospital, not at home, not even anywhere that you did not register, because there may be outbreaks for the baby.
Though preventing mother-to-child transmission is a high intervention and has huge potential to improve both child and maternal health, there's still a big challenge for the country because of low coverage and utilization of the service and stigmatization. Ogom Ezedimbo, AIT News, Abuja.